Yeah, my name is Shannon McNeair and I'm a psychologist working and living here in Geraldton, Western Australia. And I've been a psychologist for over 16 years now. And I'm a Mulgana woman from Shark Bay, which we call Guthragura. And I'm a mum of two adult sons, which I hold very dearly and kind of, it's my biggest role. Always has been. So I have a history of working in government for most of my career, where I worked in Department of Health, Department of Child Protection. Right now, though, I'm working for myself in my own private practice. And I actually get the opportunity to do the things I love and I'm very passionate about. And that's one of the things that we're speaking about today, which is stillbirth and miscarriage. When working with people from different cultures, I think it's really important to understand that um, everyone's still trying to relate, and particularly Aboriginal people, we are always seeking to understand who the other people are and where we come from. And you'll see this dynamic all the time with Aboriginal people to other Aboriginal people. Like you're trying to place who's your family, where's your country, you know, and looking at some common factors there. But one of the main things that we do really well when we do that is listening to who everyone is. So for me, um, the dynamics between Aboriginal people you'll see is they're very observant. Non-verbally, we're always looking and we're wondering and we're judging and basing who people are on a lot of our non-verbal interactions. So although the words aren't coming out, we're really taking note of who other people are. So a lot of the active listening skills that psychologists have really need to be put to use when they have people from other backgrounds, especially Aboriginal and Torres Strait Islander people. Yeah, look, I can speak about a couple of times when it's important to understand cultural differences. Even in my own um, recent role working in the Pilbara in Western Australia, I worked up there. There are very different processes, traditions, customs around sorry time, and a lot of that has to do with different ways of respecting losses. And one of those things is actually just participating in sorry time, showing your respect, not saying anything, but just sitting and allowing and understanding that someone's going through a grief process, and that is purely about being present. So we get taught a lot of these things as psychologists, but to be able to acknowledge that you care about families and that you actually show your respect is about actually going and physically attending and sitting and not doing anything other than just being with. And that, I guess, is at the core of our roles as psychologists. And I learned a lot about not speaking in spaces where we're expected to speak sometimes, but just going and being quiet and being there for the other person and truly understanding and feeling what that's like, regardless of how it feels, if it's hot, whatever. But it was a very different process, and it's helped me a lot in my practice to understand that you need to practice and adjust the way that you conduct your business for the clients that you have. And in particular, I learned a lot in the Pilbara in my 8 years living and working up there. It's where it's a shared responsibility, the grieving, and then it's actually about different communities have different processes, and I don't speak for anyone. I speak for my own community when that happens, but it has a lot to do with understanding what those protocols are. And if you have the connection and engagement with the families you're working with, you'll know because you should be asking those questions as well. So, for example, in some communities, they may want you to refer to the baby with the name, or they may want you to refer to it as a generic um, name. So your client will tell you and inform you exactly about um, what it is that happens within their family in these processes, and then you know allow them to tell you what label what reference you need to put on, the loss of their infant. What would help them? What is their protocols to be able to directly talk about that? Because we do need to talk about that with our client. So at some level, our client is coming to us as an individual, although they have these protocols and processes that occurred. You need to go there, and you don't want to make things worse. But if you've spent the time truly engaging the Aboriginal client, you'll know exactly what it is that they want to refer to. So again, my example was that it might be relieving to talk about the name of the baby in your process when they can't in their community, and then the other way around, it may be a no-go. But you need to ask the question. You need to get uncomfortable with being uncomfortable, that you're working with a population that are the minority in our community in Australia. So therefore, you're not going to be the expert on that. They are. The person sitting across from you has got all the answers to the questions that you want to ask, and preface those questions with that you don't know so much. I'd really like to know. I would really appreciate it, being really respectful in the way that you ask that, because the way that we conduct our business, our Aboriginality is very sacred to us. A lot of it's been taken away through processes and things that have happened in the past for lots of families in Australia. So look, I think there are a lot of tools and practices out there to support clinicians, purely understanding who you're working with and getting them to inform you how they'd like to work. But a lot of our practices, as certainly what I've found useful, is working in the narrative space, and understanding systems theories is really important to me, because when you're working still with one client sitting across from you, you're still working with their whole family system and how that works. If we want to kind of take that a little bit further, and I think about how I work and have referrals sent to me, I think of some of the tools that other practitioners or allied health professionals will use, such as the Edinburgh postnatal depression scale. Now, again, a lot of the tools out there aren't kind of culturally valid, but the follow-on clinical interview that people do to ask questions about who these families are and what they need is instrumental in how you approach your Aboriginal clients. The standalone inventory that I use in practice with adults is probably Tracy Westerman's Aboriginal symptom checklist. Now, again, Tracy's is fantastic in that it's a screening tool that measures, gives you some indication of depression, suicidality, alcohol and drug use, impulsivity, anxiety. But it also gives you an understanding for the level of cultural resilience of the person sitting in front of you. Again, it's a screening tool, so it will always boil down to how you as a clinician can understand the information in front of you, and then follow up with a really good clinical interview and obtain more information from the client. So being quite genuine and positive in trying to engage that client is the key. Some of the biggest challenges that people will have in the birth and miscarriage space, and some of it is from my own lived experience of losing a baby to similar circumstances. And I think that the family systems and your needs to either have someone with you to talk about it or the right person with you, like my mum, for example. I always wanted my mum in sessions with me, and then at times not. And that was about that nurture and care that I needed at the time. And I think that there's a lot of pressure still kind of put on families and mums after they lose a baby to kind of, perhaps have another baby, and they still haven't had time to grieve. They've gone through the processes of having a funeral and things like that, but to really recover and reset, allow their body to heal, and actually talk about it out loud to someone individually. Um, I feel like that's still, a space where a lot of Aboriginal women can't go to. They don't feel like they can speak to people about that, and that they may go on and have more kids, and they still need to talk about that baby and what they lost. Take the time to build your relationship with your Aboriginal clients. It's going to take longer. They're going to spend a lot of time talking about their family, and you might be thinking, when's this going to kind of get to what's at the core? But it will come with time and reflection back from you, that you understand who they are as an individual, as a family member, and as a community member, because essentially that's where we're about, not just a singular kind of family unit. We're a huge family unit. And I think, there are a lot more trainings out there as well that aren't so generic, but they are in this space for psychologists. Make it a priority on your learning plan every time, that, you know, um, what can I learn about someone else? Who can I, cultural supervision is fantastic. There are a lot of fantastic companies around Australia that offer that, and a lot of my fellow colleagues who are Aboriginal psychologists that have really good insight and supervision process. So, that goes a long way to genuinely and respectfully being able to ask the question about the things you don't know. And I think, and I've run into lots of situations where, you know, I now am very comfortable with saying, look, I really don't understand what this is. And if you can get comfortable with asking those questions, then you're going to do really well with Aboriginal people, because you need to allow them to be the experts of what's going on for them and who they are. Because past history tells us that that's not happened before either. So what I'd like to kind of discuss a little bit is about DNAs, we say, or missed appointments. And, I've kind of put a really big reframe around them, that they're actually opportunities. They're actually opportunities to understand there's something going on for your client that means they've not attended their appointment. So really trying to address what your assumptions are behind that, and actually, ask the question, what's happening for your client, and being really reflective in, how you're going to ask that question. What are you going to do differently? So and then when your client comes in, really trying to understand what happened in that last appointment or time for what was going on, because usually the issues are much bigger than your appointment for families, because there's a huge family issues going on, or that it's perhaps even way too hard.